We are going to be using a skin marker, and we are just going to mark out the applicators in this area just of the lower abdomen to identify exactly where we are going to place these applicators in our belt. Water-soluble ultrasound gel is used to allow for adequate conduction between the applicators and the skin surface. The Evolve Tone applicators are placed on the treatment area, and the pre-measured belt length is used to secure the applicators in place. The 4 Evolve Tone applicators can be placed on different body areas. In this case, we are using 2 applicators over the rectus abdominis muscle, and when using these 4 applicators, we connect them to cords numbered 1 through 4. In this case, we are using 2 applicators, and they are either connected to cords 1 and 4 or cords numbered 2 and 3. Similar to the Evolve Tight, we align the red dots and engage the pins to connect the device. Once the Evolve Tone applicators are activated, the screen display demonstrates which cords are attached and activated. The intensity of the Evolve Tone treatment is titrated to patient comfort. It is desirable for the patient to feel some element of muscle fatigue and for the clinician to see muscle contraction.